Hi, I'm Dr. Ravi Kiran. I'm a consultant liver specialist and a transplant hepatologist here. Along with me is Dr. Vinay, who is my colleague, and she is Emmany, a clinical dietitian. So we are here today to discuss about an important topic. Most of us are aware, and most doctors are aware, and general public is aware about non-alcoholic fatty liver disease. In fact, today is 9th June, and today we observe this day as International NASH Day to create awareness about disease per se, that is NASH. During this session, we would like to touch upon various aspects about the disease of fatty liver, about its epidemiology, its pathogenesis, causative factors, how does it present to the doctor, various investigations and the treatment. These days, I think most of us are aware about wide prevalence of this disease of fatty liver. In fact, fatty liver or NAFLD, that is non-alcoholic fatty liver disease, has a various spectrum of stages where it can range from NAFL, that is non-alcoholic fatty liver, that can ultimately lead to cirrhosis. In between the indolent stage of NAFL, that is non-alcoholic fatty liver, and the last stage of cirrhosis, there are various stages where the disease can progress. In that, the important stage is NASH, that is non-alcoholic steatohepatitis. So this is the stage where a person should be detected early, and preventive measures should be taken. So the progression of the liver disease is halted, and this sort of patients can be prevented to develop cirrhosis, which ultimately lead to end-stage liver disease and liver cancers. So there is no one real reason why this fatty liver or NASH develops. In fact, there are multiple secondary reasons which we can say which leads to the rapid progression of this disease. Most common among them is the presence of diabetes in the people who have diabetes and who are known to have this fatty liver or NASH. The progression of the liver disease or NASH is very rapid. And other condition is obesity. People who are overweight and who are obese, they tend to have a rapid progression of the liver disease. And also in people who have abnormal cholesterol, what we say dyslipidemias, these people will also have a rapid progression of the disease. It has been also seen that women, especially from their middle age, progression of this disease is a bit faster. In fact, what it has been seen is that the prevalence of fatty liver has increased in parallel with the increase in the obesity pandemic. So people are becoming more obese due to the various lifestyle methods they are in now. So that the fatty liver is also increasing parallelly along with the obesity. To be frank, almost 25% of the global population is having fatty liver disease in one way or the other. And if we do a liver biopsy of these 25% of the people, maybe from 16 to 60% of these people can have NASH. The theme for this year's International NASH Day is Stop NASH Now. So the people who are already having NASH, we have to prevent this year's theme is to create awareness so that we can prevent this NASH to progress to cirrhosis. Another important question what people ask us is whether this fatty liver and NASH is hereditary. Of course, I mean, when we say people, there is what is called as Mendelian inheritance, where we can say that this many percent of offsprings can have some disease. Say if parents are having X disease, by this inheritance we could say that the offsprings will have 25 to 50% of 50% chances of getting that disease. Unfortunately, in fatty liver, there is no such sort of inheritance. So we can't generally say how much percentage of offsprings would have the chance of developing the fatty liver. Of course, there are new studies where they have found out genes like PNPLA3 genes and so many other genes, which the presence of which can predict the development of fatty liver in the offspring to a certain extent. But of course, yes, there is a lot of research which has to go into it. One more question what people have to remember, and the awareness is more important, is the presence or the association of cardiovascular disease with the presence of fatty liver disease. Though fatty liver disease per se can't cause any heart disease, but by virtue of having the obesity, dyslipidemia, and diabetes, yes, the people who are having the NAFLD and NASH, they are prone to have cardiovascular disease. So, with this mild introduction and about the fatty liver disease, I would now like to ask Dr. Vinay. Dr. Vinay, how do these present? How do the patients with NAFLD present to us as doctors in the clinic? Do you have any specific symptom they come up to, or is it very vague symptoms they come up to us?
Honestly speaking, many of them have usually come either in asymptomatic stage or they don't have any symptoms as such, or they might be having certain vague symptoms which are totally not related to liver per se. But when we examine and investigate them, they usually have non-alcoholic fatty liver. So as you rightly said, sir, non-alcoholic fatty liver is a silent epidemic which is going on along with obesity, diabetes, abnormal cholesterol profile, etc. So these are the patients are usually more predisposed to involvement of liver in them. So honestly speaking, is there any particular symptom which says that he is having NASH or not? It's quite difficult. Any vague symptoms like a mild abdominal pain, decreased appetite, decreased energy can be one of the symptoms which the patients themselves present to us. And most commonly, which we see is when a patient undergoes some certain tests or ultrasound outside, and incidentally they have abnormality in the liver function test, or they might be having some fat content in the liver, which is usually given as fatty liver. So the patients are usually coming to us in those signs and symptoms rather than any particular symptom to NAFL, concerning to the NAFL or NASH.
So when a person comes to you with ultrasound report of fatty liver, what all the questions do you ask in the history? What do you want to rule out? Whether you want to rule out alcohol, whether you want to rule out drugs, what all the history you want to rule out to make sure that this is fatty liver is due to non-alcohol or due to any other reason?
Certainly, when you say per se fatty liver, it can be caused by multitude of causes.
Yeah.
It can include most commonly among the persons who are taking excessive alcohol. They can present to have fatty liver. Certain individuals by the associated complaints like diabetes or hypertension or heart disease or abnormal cholesterol profile, they tend to have fatty liver. So in this way, if a person is taking alcohol, the related symptoms could be because of excessive alcohol intake, or it could be per se a significant entity that is called as non-alcoholic fatty liver among these predisposed individuals, you can say.
And what is the role of investigating about hepatitis B and hepatitis C viruses when the people have fatty liver?
Fatty liver, as such, it can occur in any individual, as I said. So the viral infections who are having, say, hepatitis B or hepatitis C can themselves have non-alcoholic fatty liver. The significance becomes much more in them is that the fatty liver can speed up the process of liver damage. Along with hepatitis C and hepatitis B can cause more damage to those individuals. Not only we treat the hepatitis B and hepatitis C among them, we should also treat non-alcoholic fatty liver, which may be associated with the patient's presence of hepatitis B.
Do we have any age criteria, or do we see in the clinic that certain specific age people come up to you, or is it like is it seen in all the age groups?
Usually nowadays, even the adolescent age group is also having the issue of fatty liver, which is less diagnosed in them, all the way through your adult age as well as in the middle age as well as in the older age. So there is a diverse population who can be affected with fatty liver. Inside, as you said earlier, this because of this pandemic issue, most of us
obesity.
have pandemic obesity, and especially post our COVID-19 pandemic, our lifestyle has totally changed, and certain people who were having healthy lifestyles have gone to a sedentary lifestyle. Invariably, among them, the fatty liver increase incidence is seen. So one can say that sedentary lifestyle can itself predispose to occurrence of fatty liver among these individuals. Now, if you say is there any particular age group or particular individuals we need to screen? Certainly. If a person is either alcoholic, if he is non-alcoholic, if he is obese, if he is having diabetes which is uncontrolled, if he has abnormal cholesterol profile or lipid profile, which we ask for, or if he has any other issues related to hormonal imbalance like thyroid disorders, perimenopausal age group. So those are the individuals in whom we can screen and try to identify if they have a presence of non-alcoholic fatty liver. Because in a stage wise, if we see a patient's normal liver can progress to non-alcoholic fatty liver, which is nothing but accumulation of fat in our liver, to a stage where it is causing inflammation, that is NASH. So if we try to identify in this stage, it is better so that they don't progress to a next stage, that is cirrhosis, which is complete damage of the liver.
So as you said, the patients can present to the doctor in a very early stage or in the late stage. So if the patient is coming to you in a very early stage, say he has a weak abdominal discomfort or he has come to you with only ultrasound report of fatty liver, what are the investigations you would like to do in him or her?
See, best way to screen yourself or screen anyone at home if they are suffering from any liver problem or fatty liver as such is when they have certain things like obesity. I spoke. You also spoke about the obesity. Obesity can be easily identified because of our overweight. When we weigh ourselves, and there is certain parameters like body mass index, which is easy to calculate even at home. Our weight divided by our height in square in meters will give us a value. Usually in adults, if we take our body mass index, if it is between, in Indian scenario, if it is below 23.5, it will be ideal one. So if it is anything above that, they are having issue of overweight or obesity. Obesity can be identified in the way like this. Second is when a simple measuring tape can also help us to identify, where we use our measuring tape to measure around the umbilicus to see the waist circumference. In Asian population, especially Indian population, in males if it is more than 90 centimeters, quite significant. In females it is more than 80 centimeters, it is quite significant. So these are the individuals, if they have this either of these two, and if they have any other associated risk factors like diabetes or hypertension, they themselves should try to identify themselves and get tested for non-alcoholic fatty liver. Now you asked how we can diagnose. There are certainly the gold standard is to
No. If the patient is coming to you with just ultrasound report of fatty liver, what are the blood tests you are going to do in him?
See, one thing is to see the liver function test as such.
Yeah.
We'll get so much information about what is going on. If there is any inflammation, one of the markers which we try to identify is SGOT, SGPT. That is enzymes in the blood levels.
So that means that the liver is not liking the overweight.
Yeah.
Okay.
So, and second is to diagnose the associated conditions. Many of them may not be knowing that they are suffering from diabetes or thyroid problems or cholesterol abnormalities. So doing those specific tests can also be helpful so that we identify them, correct those things so that the obesity as well as fatty liver issues can be addressed appropriately.
And also you want to check hepatitis B, hepatitis C.
Certainly. Because we have to identify if there is any associated conditions, because it can speed up all these fatty liver problems to multifolds. So we have to identify them as early as possible.
So these are the patients who come to us in a very early stage. Now we have a very excellent modality, what is called as a fibroscan. Do you want to tell anything about fibroscan to the audience?
Certainly. Usually as we discussed, fatty liver patients usually come with accumulation of fat, which is usually found in ultrasound. Better modality with less invasiveness is fibroscan. Fibroscan is also a form of ultrasound which we try to do in the OPD setup itself. It gives us the idea about the fat content in the liver and also assess the stiffness in the liver. So if there is a high fat content, we can advise them accordingly. Our dietitian, clinical dietitian would be involved and she might help them in a better way so that their diet is well maintained so that there is an improvement in the fatty liver. Second is it gives a stiffness which is given in a measured value. If there is a high number, certainly the liver stiffness has progressed to a stage of fibrosis, which we don't want in them. If it is in a normal range and if it is having a high fat content, which will be given by a CAP score, which we do in fibroscan, certainly that can be prevented and it can be improved also in the future.
Yeah, this is the importance of utilizing the facility of the FibroScan. It is very easy. It can be done on OPD basis. It hardly takes 10 to 15 minutes. So the people who are already known to have fatty liver, please get this FibroScan done in your nearest health facility. Otherwise, we are always there to help you out it here in Narayana Health. So you come fasting for 3 hours. We do it in like say 10-15 minutes. You are done with it, and by that you will be able to know how healthy is your liver. As Dr. Vinay told, it gives us the idea how fit the liver is. Yeah, how firm the liver is. What is the quantity of fat? So with the advent of the FibroScan, the most of the other investigations like liver biopsies have been cut off in the protocol now. Now the liver biopsies in the patients with fatty liver is only done for research settings. So once the FibroScan is done and you have all ruled out the other diseases, what do you expect these patients to do, and where do you refer these patients next?
Uh, as we discussed now, that we have to identify first to see whether they are suffering from any other problems. So endocrinology involvement is very important if they are suffering from diabetes or cholesterol abnormalities. If they have thyroid problems, they need to take an opinion. Second issue is obesity. Obesity should be dealt accordingly. Certain people can improve upon themselves with the diet and exercise. If not, there are certainly certain procedures which can help them. Either it could be a non-invasive thing which we can do as in our center with balloon placement and subsequent diet modification, which can help us to improve the obesity, or some certain people may require a bariatric surgeon involvement so that the weight is appropriately addressed, and that can itself improve the liver functions. So involvement of our good clinical dietitians advice is important. Our endocrinology opinion is important, and certainly few peoples may require certain other things to be done with the involvement of gastroenterologist or surgical gastroenterologist, so that the issues related to the problems can be easily addressed.
So these are all the patients, as Dr. Vinay said, where intervention can help. Unfortunately, many people ignore this stage and leave the disease to progress unknowingly, and they come to us at the stage where they are already decompensated. So decompensation means the patients, they may develop ascites, fluid in their abdomen, or they can develop jaundice, or they can have that confusion and all the stuff. Once the patient lands up in that position, the only process is to maintain them optimally and prevent transplant as much as possible. But if they reach to the stage where we can't manage them medically, then transplant is the only option. As I told you in the beginning, because this disease is so indolent and slowly, and it is so slowly progressing, many patients are already in their late 50s or in the 60s when they land up in this complication, and we don't have much in our armamentarium to help them out. So it is really important for us as a society to prevent this disease progression, so that early detection in the mid ages is most important. So two things: these patients can present with no symptoms at all, or these patients on the other end, they can come up with the presence of the liver failure. As Dr. Vinay told, the most important aspect as of now today is the weight loss and diet in non-alcoholic fatty liver disease and NASH. There are so many drugs which are coming up, but none of them have been shown 100% surety about reversal of the fibrosis or improving the liver health. So it's always better to not to go to that stage. So coming to Emmany now, Emmany, so you will get references from so many departments about the diet counseling. In a typical day, how many patients of fatty liver or NASH you see, and how many of them you counsel for diet?
So, so we more often see patients with fatty liver have excessive body weight or recent weight gain, and more than 70% I have seen they are obesity, and they have a hyperlipidemia, and up to 75% are having type 2 diabetes. The reason for excessive weight gain could be leading a sedentary lifestyle with lack of exercise and poor eating habits, I can say, because due to abundant availability of food and more preference to ready availability of food like instant and ready to cook food, people tend to have excess calories and increase intake of junk foods and more preference to high fat and fast foods and increase consumption of
Refined
sugary
sugars.
drinks like soda or
Hmm.
sweetened beverages which contains more fructose also increases the calorie intake. So as Dr. Vinay said, obesity increases the risk of obesity as well as the poor eating habits can increases the risk of fatty liver. So it's very important to follow a healthy lifestyle like weight loss and lifestyle changes like weight loss or changing our diet or eating pattern can prevent the progression of fatty liver.
And when we speak about weight loss, it's not that a patient has to reduce weight very drastically. What has been shown is even a reduction in a small amount, like say 5 to 10% of weight loss, is also shown to have an improvement in the quality of the liver. So don't be under the impression that if someone is 80 kgs, he has to be 60 kgs. No, even if they reduce up to 75, 70, then also it's fine. But only thing is there must be a consistent effort about having to maintain that weight. You want to
Actually,
tell
if
something?
you, I just wanted to add one more thing is that most of the patients will say that, after 2-3 months of exercise and diet, they say, sir, we didn't lose in much weight. But if you see the scores or if you do repeat the fibroscan, they usually show a much improvement in their fat content. Certainly, weight loss is important, but even without weight loss, even if you don't lose weight, exercise definitely will help in reduction of fatty liver. So
Yeah.
many studies have shown, as you told, that just doing a particular exercise or a particular fixed time exercise is very important rather than leaving it altogether.
So what is recommended is for 45 minutes of daily walk or brisk exercise for 5 to 7 days a week is okay. Imani, what are the diet specifically you prescribe to the patient so that they can reduce weight, and what is the calorie? When do you give importance to the calorie intake, protein intake, carbohydrates? How do you tell
Yes.
them?
Yes, sir. As diet plays an important role in treating fatty liver, we do advise low fat with balanced meal because following a healthy eating habits can slow down the accumulation of fat in the liver, even it can reverse the disease progression. So patients are advised to follow low fat and low calorie diet, and we mainly focus on calorie restriction and weight loss. As Dr. Ravi Kiran said, we always advise the patients go for the gradual weight loss rather than rapid weight loss because rapid weight loss might make things worse, and if patients with fatty liver should have an individualized meal plan. So we provide customized meal plan according to their calorie and protein requirement, and also we do encourage the patients to have more complex carbohydrate like including millets based preparations or whole grains, and we tell them to avoid simple carbohydrates like more of sugary drinks and refined carbs like, for example, I can say maida based products, pastries, cakes and white bread. The list goes on, and we encourage the patients to go for more plant based food sources from vegetables, legumes like dal and pulses, and we advise them to have good fats like nuts and seeds, and they have to limit red meat and processed meat in their diet. These are the specific diet we advise the patient for fatty liver.
I have a question. Most of our patients, they usually come and say they are either rice-based diet in their natural diet or wheat-based. So, should we ask them to switch from rice to wheat or like chapati or anything, or should they can continue taking rice and add on millets along with that?
Actually, there is no difference between rice in terms of carbohydrate. There is no difference between rice, carbs, and millets. All are having the same content of carbohydrate. The thing is the fiber content.
Mhm.
We miss to have fiber in our diet. So that's what we are encouraging the patient to use more of millets because it contains more fiber in it. So it's nothing wrong taking rice, but the protein is very important while eating the rice. So if you combine with protein and good fat along with rice, I think you can maintain your diet well.
Second most common questions which we get in the clinical scenario is, can we take meat? So non-vegetarians, they usually take meat. So is there any change which they have to make in the food source? Certain meats are good or certain meats are bad or anything like that, or they can continue taking anything?
Meat
In
can be
unlimited source.
taken, but the thing is they have to limit the processed meat. Processed meat or any kind of fried thing should be avoided. They can have moderate consumption of non-veg sources is good one. It's nothing wrong taking non-veg items.
So, do you have any idea about the intermittent fasting where it has been shown that it is helpful in weight reduction? So, I mean, there were initial studies which have shown that intermittent fasting in the discussion for a long time that it would reduce. Certainly, few people, anecdotally, people have definitely been, helped by intermittent fasting. But a recent study has shown a bit paradoxical result. But yes, intermittent fasting can also help in weight reduction and in people with NASH. Anything else we want to tell Dr. Vinay about any newer drugs you know about and any other modifications what we can do in these people?
Certainly, there are a few other drugs which you mentioned in the earlier introduction part. There are many drugs which have come up. Few are promising, still in the stages of various trials. So we should wait for the full trials so that the benefits can be passed through. Certain drugs like metformin, which is used for diabetes, can also help in fatty liver. Certain drugs like vitamin E, which is commonly used by most of our practitioners.
And omega fatty acid, which is there in the
fish oil, etc. Now, newer drugs like obeticholic acid is coming up, which is quite significantly shown to improve. And certain drugs like saraglitazole, which commonly comes in the brand name of lipaglyn, has also shown few results in improving the fatty liver. But certainly, there is no wonder drug which can completely prevent or improve the fatty liver. The wonder drug is, as Madam mentioned, the diet and good adequate form of exercise are the two important drugs which they should take. And if they do it, I think fatty liver can be prevented. And fatty liver, once it occurs, even if it is there, it can be even reversed to normal liver. But once it progresses to fibrosis, then it will be difficult. So identifying early is the most important thing in the management.
So that's it, guys. This was an excellent discussion with Dr. Vinay and Emmany about fatty liver. Both of them were good in including and speaking about main points about the fatty liver, the disease, and the dietary modifications what we can make. Thank you.